All right, the president might be thousands of miles away and won't be coming back until next weekend, but a budget rollout is still planned, with one that will include $800 billion in so-called cuts in Medicaid over the next 10 years. Centers for Medicare and Medicaid Services Administrator Seema Verma with that. Administrator, very good to have you.
It's great to be here. Thanks for inviting me.
Do these represent outright cuts? In other words, are we going to see less in Medicaid spending with these proposed cuts year after year than we have already built in?
Well, first off, the Medicaid program is a program that's supposed to be a joint state-federal partnership. This program serves the aged, the blind, the disabled, pregnant women, and children. But unfortunately, what we've seen in this program is that even though it's one of the highest budget spend for states, even though we're spending this much money, our outcomes have been very poor in the Medicaid program. A third of doctors won't even see Medicaid patients. There's been studies that show that even when people have Medicaid, their outcomes are actually worse than people that don't have health insurance at all. So what the budget's going to do is going to follow the American Health Care Act, which is going to sort of redefine the relationship between the state and the federal government and try to empower states so that they're in the driving seat making decisions to help improve this program so that we can actually focus on improving outcomes in this program.
You know what, you would think, given a lot of the press reports, Administrator, that they're gutting this thing, and I was looking at the spending and how it's been running at least year in and year out at double, sometimes triple the inflation rate. For example, in the latest year, up 9.7%, and furthermore, on pace to cost $5.7 trillion over 10 years if it just stays where it is now. So the president's proposal would maybe bring that down to around $5 trillion. But my point is that it grows at an exponential rate. So obviously any percentage gain off these lofty levels belies how much we plow into it.
Yeah, so what we're proposing here is that, we're not talking about cutting the program. What we're talking about is starting with where the states are right now and then moving to a more predictable growth rate. So this will provide predictability for both the states and the federal government. And so right now what we have going on between the states and federal government is every time the states want to make a change, they have to come to the federal government to ask for permission. And we have to review every single one of their changes. It takes us almost 6 months to review even a routine change. And so going forward, by putting the program on a more predictable budget pathway, this way we know that we can actually turn the conversation away from finances to actually start talking about how we can improve care for the beneficiaries. These are people that don't have a place to turn. These are folks that are going to be on the program for the long term, our disabled population, poor children, pregnant women. So we need to start thinking about this program and how we can try to improve the outcomes, because right now this program is not performing well.
You know what I always worry about, administrators? We do this all the time, and the media collectively, that it would include me, then we are part of the problem in that we misstate what are cuts. A cut would be going from this amount to a lesser amount. Then we do the same pretty much when it comes to, trying to revamp the health insurance law. When we talk about 24 million people who'll do without insurance when it's 11 or 12 million who have Obamacare now. We're basing that, I guess, on estimates about how many potentially could be affected over the next 10 years. But do we do a disservice when we play fast and loose with this data?
Yeah, well, you bring up a great point. If we look at Obamacare and they talk about the people that they covered, they actually put the majority of the people that were covered by Obamacare were put into the Medicaid program. So this is a program for disabled individuals, and here we are putting working age adults into this program while people that are disabled are on waiting lists. And this isn't even a program that is functioning well. A third of doctors won't even take a Medicaid patient, and we know that the results have not been great. So the status quo is not acceptable in the Medicaid program. I think we can do a much better job of trying to focus on improving outcomes and trying to control the program in a more sustainable way that works to actually put states in control of the program. Right now there's just this constant back and forth between the state and the federal government, and states are not in a position to develop innovative programs.
And to your point, it's out of control. When you're talking about upwards of $10,000 per individual, I mean, that's out of whack as it is with a program. I know Apples and Oranges Administrator, but even SNAP, the modern-day food stamp program, it's up to 44 million beneficiaries getting some sort of food support. Now, no one wants to starve anybody. I'm not saying that, but 44 million versus 28 million, not even 8 years ago, double what it was 8 years prior. This is all out of control, isn't it?
Yeah, what I think is really out of control is the relationship between the states and the federal government. I mean, this is a program that states are funding, and yet they have absolutely no control in this program, or very little control. I mean, every decision that they make is reviewed by the federal government, and there are so many regulations and so many requirements that they have to adhere to. And so they're really not in a position to be innovative around their programs. And if they want to try something that might be something different, they have to come to the federal government, they have to seek a waiver, and these waivers can take, over a year to get through the process. And so that really prevents them from being innovative. We need to move our Medicaid program into a program that's going to improve access, improve outcomes, and for the individuals that are capable, the non-disabled adults, trying to get them into a system where they can start looking to getting jobs. And so develop them that actually starts to help improve the lives of beneficiaries.
Well put. Seema Verma, CMS Administrator, very good having you on.